Hi, my name is Erin and I'm going to be your nurse today.
Okay.
I'm going to start out by making sure I have all the equipment I need.
Alright.
I have my stethoscope, which I'm cleaning for infection control. I have a pen light, a pair of gloves, and hand sanitizer, which I'm going to use now for hand hygiene.
Alright.
I'm going to start by asking you if you use any assistive devices.
Nope.
And if you feel any pain or pressure during the assessment, just let me know.
Okay, sounds good.
Can you tell me your full name
Kelsey Bork,
and where we are
Union Ave,
and the date?
November 16th.
The patient is oriented ×3. Her level of consciousness is appropriate. Her speech is clear and not slurred, and she can appropriately respond to questions. I'm going to tell you 3 words, and I'm going to ask you to remember them till middle of our assessment.
Okay.
They are chair,
Chair,
red,
red,
and house.
house.
Okay. Can you smile for me? And frown. And puff out your cheeks. And raise your eyebrows. Patient's cranial nerves are intact. And next I'm going to have you touch each finger to your thumb. Perfect. Patient's fine motor skills are intact. I'm going to ask you to close your eyes, and if you could just tell me where you feel my touch.
Right foot. Left hand. Right cheek. Right shoulder.
Patient's sensation is also intact. Next I'm going to assess your gait. So if you could get up and walk to the end of the room and walk back. Patient's gait is normal, no signs of limping or swaying. I'm going to assess your balance now. If you could just stand on one foot and the other one. Balance is normal and intact. And then put them together and put your arms out. And then close your eyes. Patient's coordination is also intact. Next, I'm going to move to your spine. So if you could touch your toes. Going to palpate the spine. No lumps or lesions are noted. There's no curvature leading to scoliosis, lordosis, or kyphosis. Next, I am going to move to the head so you can take a seat. Actually, I just realized I forgot something. If you could stand back up. Sorry. I'm going to assess the range of motions of her upper extremities. So if you can move your arm in a circle. No crepitus is felt, and then move your elbow. No crepitus, and your wrist. No crepitus, and then this side. No crepitus. No crepitus, and your wrist. No crepitus. If you could face towards me so I could assess your muscle strength. You put your arms straight out and push down, and then up, and push in, and then push out. And then if you want to bend at the elbow, and push up, and push down, and then your wrist, so like your fingers, you can push up, and then push down. Patient's upper extremity strength rates a 5 out of 5. Next, I'm going to assess your hands. Skin of the upper extremities and the hands is pink, warm, and is dry. There are no lumps or lesions noted. Skin turgor. There is no tenting bilaterally, which means hydration is adequate. There are no signs of clubbing or cyanosis, and capillary refill is under 3 seconds bilaterally. Next, I'm going to look at your pulses. Radial pulse is a normal rate and rhythm. It is equal bilaterally and rates of 2+. Now you can sit down. Before palpating your head, I'm going to put on my gloves for infection control. Okay. The head is appropriate size and shape. It is located midline on the body. The skin is warm to the touch. It is pink and it is dry. Assessing the hair and the skull. Hair is evenly distributed. There is no sign of critters, and it is an appropriate color for the patient's age. There are also no signs of lesions, lumps, or masses. Next, I'm going to move to the patient's sinuses. So if you could tell me if you feel any pain or pressure.
No.
No pain or pressure was felt among palpation of the sinuses. And I'm going to do the same thing with your lymph nodes. You feel any pain or pressure?
No.
Lymph nodes could not be palpated. The trachea is midline, and the skin of the neck is warm, pink, and dry. Next, I'm going to ask you to perform range of motion of your neck. So if you could touch your neck to both shoulders, and then up, and then down. Range of motion in the neck is normal. Next, I'm going to ask you to swallow. Swallowing is intact and thyroid cannot be palpated. Now I'm going to move to your ears. Ears are pink. There's no excessive drainage, and there is no nodules, lumps, or lesions. Look on this side. This ear is also pink, and there are no lumps or lesions noted, and there's no excessive drainage. To test the patient's hearing, I'm going to perform a whisper test. So if you could just repeat what you hear me say.
Pumpkin. Curtain.
Patient responds appropriately to the whisper test by repeating the right word. Next, I'm going to move to the patient's eyes. So the sclera is white, the conjunctiva is clear, iris is blue, and the pupils are round and approximately 4 millimeters. The eyes are appropriate size and shape for the head. I'm going to start by testing her fields of gaze. So if you could just follow this without moving your head. Fields of gaze is appropriate. She can correctly do all 6 fields. Next, I'm going to test peripheral vision. So if you could tell me when you see my fingers.
No.
Peripheral vision is intact. Now I'm going to move to the pupil. So if you could stare at my nose. Pupils respond consensually bilaterally to light. And I'm going to test for accommodation by bringing this into your nose, if you could just follow it. Patient can appropriately accommodate, and the Perla test is complete. I'm going to move to the patient's nose now. The patient's nose is appropriate shape and size. There is no excessive drainage. Do you have any trouble smelling?
No.
The patient does not report any trouble smelling. If you could close one nostril and breathe in, and then the other one. Patient can breathe equally through both nostrils. Just gonna look up your nose. There is no deviation of the septum. And next are the lips. So the lips are moist and pink. You could open your mouth and say ah. Patient's tonsils are not swollen. The uvula responds appropriately by rising. The inner mucosa is pink and moist, and the teeth do not contain plaques. If you could stick your tongue out and move it to both sides. Patient can correctly move their tongue, meaning they do not have a deviation. The tongue is appropriate shape and size, and it is pink in color. Next, I'm going to feel your jaw. You can just open. No crepitus is felt upon palpating TMJ. And then raise your shoulders. The spinal accessory nerve is intact. We are going to move to the heart, so I'm going to listen to some heart sounds. And I'm going to do the same thing with the bell. Heart sounds are normal. S1 and S2 are present and no abnormalities are heard. And now I'm going to feel your carotid pulse. Carotid pulse is equal bilaterally and rates of 2+ in strength. It is at an appropriate rate and rhythm. Now I'm going to also take the carotid pulse. Auscultation is normal. It does not, no bruits or whooshing are heard. Next, I'm going to assess lungs. So if you could stand up for me. And turn this way and take a deep breath. Lung expansion is normal. Then turn around and take another deep breath for me. There's no barreling of the chest. The chest rises equally bilaterally. Do you have any trouble breathing?
No.
The patient does not report any trouble breathing. Next, I'm going to listen to your lung sounds. So I'm going to ask you to take some deep breaths again. All right. And another. And another. And one more. Patient's lung sounds are normal. No bronchi, wheezes, or crackles are heard. You can sit back down now. I'm going to ask you to recall the 3 words from the beginning.
Chair, red, and house.
Patient's short-term memory is intact. Next, I'm going to move to the abdomen. If you could lay down with your knees bent. I'm going to pull this up. The skin of the abdomen is pink. It is warm to the touch and it is dry. I'm going to listen to bowel sounds now. Bowel sounds are present in all 4 quadrants and no abnormalities are heard. Now I'm going to listen for vascular sounds. Vascular sounds are normal. There are no signs of an abdominal aortic aneurysm. Next, I'm going to palpate, so if you could just tell me if you feel any pain or pressure.
No.
The patient does not feel any pain or pressure during palpation of the abdomen. You can sit back up now. Actually, stand. Thank you. I'm going to assess the range of motion of the lower extremities, so if you could move your leg back and forth. No crepitus is felt. And bend your knee. No crepitus is felt. And your ankle. No crepitus is felt. And then the same on this side. No crepitus is felt in your knee. No crepitus and your ankle. No crepitus is felt. You can sit down. We are going to assess muscle strength now of the lower extremities. So if you could put your legs straight, wonderful, and then push up, and then push down, and then bend at the knee, and push up, down, and your ankle, up, and down, good. And then this side, push up, and down, and then bend at the knee, and push up, and push down, and your ankle, down. Lower extremity muscle strength rates a 5 out of 5. The skin of the lower extremities is warm, dry to the touch, and pink. There are no lumps or lesions present. Next, I'm going to move to the feet. So I'm going to start with the pedalis pulse. Pedalis pulse is equal bilaterally and rates a 2+. It is appropriate rate in rhythm. The posterior tibialis pulse is also equal bilaterally and a 2+. Next, I'm going to do skin turgor. No tenting is apparent, which means hydration is appropriate. There's no clubbing or signs of cyanosis on the feet. And capillary refill is under 3 seconds bilaterally. The skin of the feet is warm, dry, and pink. There are no lesions or lumps present.